Caring for a Batten's kiddo is relentless. It's exhausting. It's heart-wrenching. It's painfully beautiful. It's hard. It's humbling. And it's full of grace and tears.
Being the parent of a kid with Battens means even when you take a vacation day off of work, you're never really on vacation. You're always aware of all the things that have to be done, and then you're aware of the bigger, harder piece that's coming. Their loss of skills, their loss of abilities, their loss of themselves, and ultimately when you lose them entirely. So, taking a day off means having to grapple with a lot of things. There's a lot of struggle, there's a lot of anger, there's a lot of grief, and there is a mountain of patience required to be my Sophia's mom. Now it's hard, but I will say there is a gift, because I can never talk about this disease without saying the gift. And the gift is that you become aware of what you have and what is going to leave. And so you try to squeeze every bit of joy out of every moment, no matter how difficult it is. And having that kind of awareness is the gift.
I start every evening with a baby monitor and a seizure monitor on. My daughter's 14 years old, so it's a lot. And about 2 in the morning, she usually starts calling for me. I go downstairs. On good nights, I can get her to go back to sleep. On bad nights, we're up. Sophia can no longer stand. That happened within the last 1.5 to 2 years. She is unable to now, within the last couple of months, really sit up on her own. We use a lift and a sling to reposition her. It terrifies her because of the advanced stage of her disease. Her brain tells her she's falling, not once or twice, but probably 500 times a day. She screams, "I'm falling." There's a lot of repetition in a Batten's brain. And so there's a lot of needs and demands and requests and confusion that happen. Now, it's very common to answer the same question 100 times and be pretty confident you'll probably hear that same question 100 times more. Sophia can't handle the agitation of multiple people talking at the same time. So we can sometimes bring a friend in as long as nobody else in the house is really talking or doing much of anything. On a good day, Sophia screams and cries 2 or 3 hours total. On a bad day, it feels like the entire day is screaming in agitation. On a good day, she's taking 13 pills 2 times a day, with some sprinkled in the middle of the day. On a bad day, that number can climb as we are giving her all sorts of other drugs, like things that should try to help calm her raging mind, but it's interesting how little sometimes they work. Well, we're past the halfway point of this journey with Sophia. It's heartbreaking, and it's a lot like living with PTSD. It's not post, it's just trauma, and you're just surviving. Prior to being diagnosed with this disease, used to run and jump and sing and never cried and never was angry or sad and was the happiest child in the world. In many ways, I lost my daughter years ago. The person that I take care of now is my daughter, but isn't my daughter.
Being a caregiver to someone with Batten's disease is the hardest yet most rewarding experience of my life. I'm quite certain that these souls are some of the most choice children on the planet. They are sweet, they are kind, they are giving, they love fiercely, and they need someone to protect and care for them. While caring for my 2 children with Batten's is so hard on my body, my heart, and my soul, I wouldn't trade it for anything in the world.
Hi, my name is Kylie. This is my 3.5-year-old son, Odin. He was diagnosed with CLN1 infantile Batten disease in February of 2021, just before his 2nd birthday. He currently struggles with all symptoms of Batten disease, dementia, seizures. He has lost mobility, and he can no longer eat on his own, so he had a G-tube placed last year. Currently, we struggle with day-to-day life with Odin. We received a wheelchair through state aid in May of 2021, but he has, at this point, grown out of it. So we reached out to Rare Sisters Batten Foundation for help in getting him a new wheelchair. to better improve his quality of life. Rare Sisters Batten Foundation helps families like ours continue to live as normal of a life as possible.
Dear Rare Sisters Batten Foundation, thank you all so much for this grant. This is absolutely life-changing for us. Unfortunately, over the past year, Lily's mobility has declined enough that she is full-time in a wheelchair, and we are having such a hard time trying to get her out for everyday activities and doctor's appointments. But we don't have to worry about that anymore. She was able to enjoy going to the swimming pool again this summer. Being able to get her out of the house and doing fun activities and be together as a family has really helped us feel a little better about our situation and gave us something back that we didn't realize we were missing. Gratefully, Holly.